Morning. Well, I don't know exactly what everybody wants to talk about today, so I tend to kind of make this a little more conversational. Let me go through just a couple of things about how the elections turned out in Kansas, and then we can kind of go from there. Just a few expectations of what we think this session's going to be like. I know Democrats walked into this session thinking that this election thinking that they were going to erode, if not eliminate, the supermajority in at least one of the chambers of the Kansas legislature. It in fact went the opposite direction, and the Republicans took even more control of the legislative branch of government. Now, I know that, full disclosure, I'm a former House Democrat. I know that the folks that I hang out with are pretty, in despair about some of that, and even some of you have kind of talked to me about that. But I guess, we need to approach anything with some level of optimism. There's always opportunity, okay? Under the dome, we can always find people that agree with us on something, all right? So in my world, I focus on healthcare and public safety. That's my job. I represent EMS and this sort of stuff. One of the biggest opportunities that I can find right now, and we need to be thinking about this here at the Farmers Union, is conservatives really tend to embrace, sort of having folks practice at the top of their license, right? Is kind of how we put it. Expanded licensure things. So the Kansas Farmers Union a few years ago was involved in a thing to try to fill the provider gap, particularly in rural Kansas, for dentistry. So they had this. It's called the Kansas Dental Project. I was involved in that a number of years ago, and so that was an initiative to have like a nurse practitioner, but for dentistry. All right. So you'd have a hygienist that gets some extra training, fill some cavities, right, and fill a provider gap that's out there. We couldn't get that passed a few years ago, and it was because the legislature was much more made up of folks that are kind of in the center. The folks on the far ends of the spectrum embrace that kind of thing. And currently, right now, I'm working on a deal with EMS to talk about having, they call it community paramedicine. So paramedics coming to the home to give some basic care, telemedicine, things like that. There are always opportunities. So I just want to get that just right off the bat. Let's speak in terms of opportunities. So what do I think is going to happen this session? I think that agriculture in particular, there's probably not going to be a lot of substantive policy moving forward at the state level. I don't see a whole lot going on there. There is, however, some opportunity in just sort of building some infrastructure in rural Kansas. There are folks right now talking about housing initiatives. Now, I don't think any particular idea has sort of, anybody's kind of coalesced around a specific proposal. But housing in rural Kansas, as you all know better than I do, is a tough situation. It's tough to get contractors out. It's tough to meet appraisal values, all of those things. And those are actively being discussed. And it's something that is an opportunity for the Kansas Farmers Union to be involved in. Medical marijuana, that's on the thing, right? So that has been getting medical marijuana has been getting some play. It'll, just in full disclosure, I've represented you guys long enough that, because I think I'm probably at like a decade or more now, I don't know. So I can be real honest with you guys. I cannot, for the life of me, understand how it seems like the stick-in-the-mud conservatives have taken pot from, the more left-leaning folks, but it kind of seems like they have. And that just blows my mind. But here we are. So there's opportunity there. There is, I'm trying to think of other things right now. Nothing's coming immediately to mind. I mean, obviously, Medicaid expansion is something that is near and dear to my heart. I've been, I was on the board that created the Alliance for a Healthy Kansas. I've worked for them since the beginning. And that's going to be obviously an uphill battle at best at this point, right? I mean, let's just be honest about it. But what we can do is insert that into every conversation that comes in front of us. When the legislature is talking about homelessness and mental health, which they're actually, that mental health is another place I see a lot of opportunity. Medicaid expansion needs to be right at the front of that. We need more, rural voices on that, in that push. And that's what it's going to take to eventually get it around, is just building and building and building all over the state to where it just cannot be ignored. We passed Medicaid expansion in 2017, and it was through intensive organizing around the state. We had people calling their legislators and demonstrating it, and there's just been an extreme advocacy fatigue on that topic, but it couldn't be more important. It just couldn't be more important. It seems to be showing more and more every day why it's more important. And so we just have to view this as, hey, yes, we're behind. Now it's time to catch up. We're going to find that opportunity. We're going to find the opportunity when we're working on all these other issues that we think the conservatives will come along with us on, and we're going to insert that into it. Lots of Republican states have expanded Medicaid. Lots. So it's not, there is a very serious conservative argument for Medicaid expansion. So that's where that's at. Are there other specific policies, that we want to talk about, or just, sort of where the legislature's at? I always just tend to make this a little more conversational than.
Let's open it up. Are there thoughts in the crowd that, Donna?
Yes, ma'am.
So, good morning. So when you said you passed Medicaid expansion in 2017, what does that mean?
Made it through the House and the Senate. Governor Brownback vetoed it. I fell short 2 votes of overriding his veto.
So we have to go back through the process now?
Yes, ma'am. Yes, ma'am. This is a brand new legislative session. So Kansas, just as a little bit of a extra on that, Kansas works on a biannum basis. So this will be the first year of the biannum. So it'll be a little bit of a slow start, because essentially all the legislation gets wiped out. There's no bills in the hopper, okay? So everybody has to rewrite all their stuff and then reintroduce it and whatever else. You start from zero. Next year, every bill that has not made it through the process is still sitting there on day one when they walk in. So these years start out a lot slower. Just as a point, it wasn't directly about what you said, but. Yes, sir.
Yeah. This may be a stupid question, but bear with it. From what I read, the stated objection of Republicans to expanding Medicare is going to cost the state money. What's the real reason? Because here's my point. Let's say a hospital in Trego County goes bankrupt. Trego County, I'm sure, just basically elects Republicans to state money. That guy's going to get a lot of heat from the people. People got to go, another 50, 60, 70 miles, maybe to an emergency room, or they're not going to like it. So is there a reason other than a real reason other than what the state reason why they object?
That depends on the individual legislator. I've got some that say that their interest is mostly in like the national debt, which I too share those concerns, but not on that, right? I too look at those numbers on the debt clock and go, holy cow. But there's a lot of other ways to address that, and not the least among them, would be to let some certain tax cuts expire. But, when you're talking about Medicaid expansion, you have 40 other states, most of them much larger than Kansas, that have expanded. And so that is a big thing that they say. They also talk about crowd out. They talk about how, there's already a provider shortage, and there is. But again, we are not unique to these things. You can go to any other state. It's not like Nebraska has a very different situation than what Kansas has. and they're not rolling that thing back. You know, once Oklahoma, I mean, come on. Kansans want it. They always have. Every poll we've ever done is north of 70%. And for whatever reason, here we are.
Did Nebraska's expand?
They did, but they did that by ballot and referendum. It's the same as Oklahoma and Missouri. You know, this medical marijuana, Medicaid expansion, a variety of other issues. Quite frankly, they go to a vote of the people. They pass. When you have to elect somebody, there's a brand or a personality flaw or something that isn't getting the people that represent those issues elected. And that needs to be addressed.
Do you foresee the Kansas Chamber of Commerce changing their initiatives as far as Medicaid expansion? Because I know that they were very not for it in the last legislative session.
Yeah, I mean, they started out for years. They were neutral, you know, and then we kind of started building some steam, and they came out pretty opposed. No, I think we're going to have to run them over. I mean, I don't think there's two ways about it. Got to build the track, clickety-clack. I'll answer all the questions. I mean, we've gotten to know each other over the past decade. You guys can ask me about anything. I'm open for it. And it doesn't have to be just about expansion. You know, like I say, I've been around. It's almost, I think this is going to be my 18th legislative session under that dome, so whatever you got.
So just so you know, this afternoon we're going to be doing our policy work. This is everything that Sean represents us on at Topeka. So it's really important, the work that we're doing this afternoon and updating this and making these changes, because this is what we tasked him with when the legislative session starts up in January and wraps up in May. So whatever's in here, this is who we are. So keep that in mind.
Yes, sir.
What do you anticipate with K-12 public education?
Well, there's going to be more initiative, I'm sure, on some level of as they say, school choice. That seems to be kind of where folks are going with that. I don't follow education a whole lot, but that's one I got to say, like, of all the Medicaid expansion, I feel like that's an issue that's just poisoned, and in a tough way. But education's kind of the same way. I would criticize my Democratic friends a little bit that they don't allow any kind of discussion or bring any new ideas, where the Republicans on this side is just like let's drain money out of public education, and it's a toxic environment. Yes, sir.
Are there any checks and balances to the referendum process? Think about animal rights groups, they can use that process quite a bit, pass some of their agendas.
Well, Kansas doesn't really have ballot and referendum for at any real level. So you can get something on the ballot, but it has to go through the legislature first. And it's the same lift. I mean, it's the same problem that I'm having with Medicaid expansion, right? I would have to get a bigger lift to get it through the legislature. I believe it's 2/3 in both houses to get something on the ballot, and then to the vote of the people, right? So, like, that's why we don't see, all these issues coming up on our ballot all the time. Only when it can pass that level do you ever see it. So our Constitution doesn't get as busy as, say, Missouri's or other states. So
Do you do that the way the Constitution reads?
that's exactly right. That's just the Kansas Constitution, the way it's set up. We don't have much of a ballot referendum. Otherwise, we'd have had Medicaid expansion a decade ago.
Yes, ma'am.
You mentioned before provider shortage and Medicaid expansion. Could you explain that a little bit more, the connection?
Yeah, so the argument goes that there are
There are shortages in various providers. I mean, so in rural Kansas, there's an OBGYN desert, west of 81 Highway for the most part. I don't think there's a psychologist west of 81 Highway. There's deserts of those kinds of shortages in the urban core, in, you name it. And then there's some things like just the basic personal care attendant that takes care of people as they age, or people with disabilities, and that's statewide. There's not nearly enough of them. And so what they're saying is, you're bringing more people into the system, so they're going to, tax that already strained system even more. The flaw in the argument is that, quite simply, two flaws, I guess. One is that it's not like those folks are not accessing the system at all now. They are. They're doing it in an extremely inefficient way with poor outcomes. And the other is, if you inject more money into a system, you tend to be able to pay more and attract more. That's the other side of the economics. So that's the basics,
One more question.
Oh, I got lots of questions.
I'm politically naive about how either party functions in the state of Kansas.
You and me both, my man.
But it is stunning to me that when I get my ballot, where I live, there are mostly unopposed seats. Nobody is actually running on the Democratic side. And I'm more like, nobody. I mean, it's just, you really, on my ballot, until you go to the national level, I really have no choice but a write-in or a Republican. Do you know why that is?
Yeah, it's a terrible job that I don't know why any of us would ever apply for. I mean, been there, done that. I treated it as a, my service to my state is I treated it as though it were a master's program. I mean, that's really, to me, that's what it was. It was a master's degree. Got me here. If they did raise the pay on it, which helps, but if you're to try to maintain a job and do that, it was, the good news for all of y'all is the system was designed for farmers, right? You show up in the middle of January and you're there, up until about the beginning of April. You come back a little bit at the end, whatever, right? Like it just run, but it is full time during that time. So how do you take off, a big portion of the year like that for most folks? And the answer is they can't. They can't do that and maintain their family life. They can't do that and maintain their careers. For me, it was just a great start in life. So that's one big issue. Again, they helped out the pay. We're a big state, so the further away from Topeka you get, the harder those things are. Like I say, I genuinely believe that in rural Kansas, y'all can verify this better than I can, but I think that the Democrats have kind of ruined their brand, and they need to get out there and instead of, this is my free advice, instead of recruiting the activist types, you got to recruit people that are on the local bank board or the local hospital board, people that are well known, that they don't necessarily have a party affiliation, but they've been known to serve their communities, and then build it from there. And their campaigns need to be what it's going to have to be. You're going to have to find areas that have substantial parts of it are walkable, and I mean strong door-to-door strategy. So I got involved in politics. I got involved in it before this what I'm about to tell you. But my first run at public office, I was opposed by two people, endorsed the other guy. Okay, my House district was split with two Senate districts, and you'll probably recognize both of the names. One is the longest-serving Kansas legislator in state history. His name was Anthony Hensley. He endorsed the other guy and went and knocked doors with him and whatever else. The other is Governor Laura Kelly, opposed me. And I am proud to say I beat that guy by like 15%. How did I do it? because that locked me out of being able to raise money. Okay? It like completely locked me out of it. What I was able to do was to go out and knock on doors and talk to people. And you have to have a little bit of, walkable neighborhoods to be able to do that. But when you do, you can make a real connection with people. Those House seats are only 20,000 people. And of that, there's only a certain amount that are going to vote. So if you're not one of those, if you can walk out there and have some people skills and knock on some doors, they're winnable. But that's where it's got to start. You got to start with a good candidate that can do some of that stuff, and you've got to find somebody that is able to structure their life around it. Those are very high obstacles. And that's why we end up, and that's not to mention things like gerrymandering and whatever else that make kind of safe districts. Okay? Those are the things we can control. Well, I can't control anything else. So.
Okay, one more question then. A few years ago, I switched my affiliation, and I got behind a Republican Senate candidate, and he won. 4 years later, he was smeared by the so-called Americans for Prosperity in the primary and lost. So, and he was helpless against that onslaught of postcards. And so it's like, he was a good, moderate senator. I was again, it's like, I don't feel like I've got a choice.
Right. Yeah, I mean, outside money, all these sort of things, they're going to get involved. You just have to. What makes you bulletproof is when you have, that history of sort of helping out your community. And I think I know who you're talking about, and he sure had that. But you got to get out, and he had some challenges because of COVID. Because I would be willing to place a pretty big bet. I know exactly who you're talking about. He had challenges because of COVID, but those folks they're going to get involved, and you just have to square up and go get it. You can't just attack postcards with postcards. People don't care about postcards. You're going to knock on some doors, meet people, stay involved, stay up front.
I really don't have time for another question. Sorry.
Oh, I talk too much. Sorry, guys.
Okay, all right, go.
The opposing Medicaid expansion because it aggravates an existing provider shortage. That's healthcare rationing. And is that an effective argument that, we ration these people out of it now, who's next?
So here's the thing is I don't give a lot of credence to any of those arguments because I've been in this since the beginning, and it's always been a game of whack-a-mole, right? You hit one, another one pops up. And you're not wrong. So I have to go see a specialist right now, something that I had a problem with, a couple weeks ago. My appointment is in late February, right? And I have good health insurance. I do this stuff for a living. That's just where we're at. Yeah, I mean, that's what it, but again, it does, you nail one down and it's just two more come up, and it's all just excuses, and we just have to see it for that and plow forward.
Okay, thank you, Sean.